Everyone in the world needs to know this. For 16 years in practice, when they would come in from around the world, we had 17,000 patients from 17 or 16 different countries. When they would come into my office, they would list out their concerns while they were there. And then I would make them on their intake form write down every drug that they were on and prescribed and when. I want to know when their symptoms started. Then I want to know when they were prescribed a specific drug. And then before they would come back on the next day or the following day, it was usually a 2-day period before they'd come back for my report to go through with them. I had someone in my office actually take their drugs that they wrote down, that they were prescribed and taken every day. And I had someone in my office go to the physician's desk reference and actually print out every published side effect of that drug. And then we actually put them all together on a piece of paper in the report. Like, you're on Imitrex for migraines. These are all the side effects with it. You're on this statin drug, Lipitor. These are all of its side effects. And then whatever the patient wrote down as their primary complaints of why they were in my office, I had the person in my office go through their side effects of the drugs and highlight every single one of the specific complaints that person was living with. Yeah. And it was the most eye-opening thing. Before I even walked in the room, they would be looking at their list going, I didn't even know my drugs were causing my problems.
Right.
I have done that for years as well, and it is the most fun thing to do. I thoroughly enjoy it.
Yeah. And I have to tell you, I'll give you an example. So this is going to happen a lot for all of you. A lot of you are going to write in that you have musculoskeletal pains, like big joint pain, my calves cramp, I have pain. And I've been diagnosed with, complex regional pain syndrome, which is like the most ridiculous diagnosis ever on the planet. There's just ridiculous ones. Okay. So they got this area of their body. Doctors can't figure out what the pain's coming from, but they have it, and they've had it for years. When they would come in, this is not a joke. If it was anything body pain-wise, which is the number one reason why anybody's on drugs ever, all I had to do was look and see, are they on a cholesterol drug? Mm-hmm. And when I was in there, I would just go like this. All right, so how long have you had this pain? And they would go 3 years. And I'd go, how long have you been on this statin drug, cholesterol drug? It was always 6 months to a year before the symptoms started.
Every time.
And then I would go like this. All right, so this is what you're going to do. You're going to stop your cholesterol medication like right now because there is zero side effects to stopping it. But the number one most common side effect of every single cholesterol drug is musculoskeletal pain. And none of them even knew they correlated. It's phenomenal. All right, so I want to speak to something else because this is really interesting because people just don't know. I had a billionaire that came into my practice one time. I'm not kidding. Drives in his $1 million Bentley car. This guy had developed a condition called aphasia. And a lot of people didn't even know what this was until Bruce Willis just announced that he's retiring from acting because he's been diagnosed with this aphasia. This means as your brain thinks to say something, you can't speak it as fast as you think it. So, yeah, if Bruce Willis is being talked to in a scene, he would think what his response should be, but it would take like a 30-second, 1-minute delay for his mouth to actually say it. Well, I had this guy come into my office, and he, for 2 or 3 years, was struggling with aphasia. It was so delayed that he wrote down on an iPad or on I had a Magnadoodle at one point. And he would actually write out his answer because it would be faster to write it down before his mouth would say it. It was awful to watch, and he hadn't been to a board meeting. He had built this massive corporation. He had not attended a board meeting in 2 years because of the embarrassment in front of his board with this issue. Right before he came to my office, he actually had been to the Mayo Clinic 5 times in the year prior in Wisconsin. 5 trips to the Mayo Clinic. They ran every diagnostic test you can think of. And every time I would ask him and go through his medical records, everything he received from the Mayo Clinic was, you do not have this, you do not have this, you do not have this, you do not have this. Most of the time with medical diagnostic tools and visits to hospitals, they're trying to identify what it isn't to get to the target of what it is.
Yes, and then they have just random diagnoses by exclusion.
Yep.
Which is the most ridiculous thing ever. Yes. And someone's like, I finally have a diagnosis. I'm like, no, you don't. That's code for I have literally no idea what's wrong with you or how to fix it.
Yep. So this guy went 5 times, spent months in these 5 visits the year prior to my visit to my office in Frisco, Texas. And I looked at him and I said, well, thank you for your intake form. I'm glad to meet you. I would like to see if I can help you. And I really had no idea what was causing this guy's thing before he left. So he leaves. I go through his intake form, do my report, do my exam. From the exam, I had an idea of what it was so that I had to go confirm it. So I went to my house that night. I'm not kidding. After hours, I went home and I took his drugs that he was prescribed. And I went through each one of them and I wanted to know, is there any research studies showing that these drugs that he's being prescribed cause aphasia? That at this point, I never even knew the word aphasia. I had to go look it up. Like, what does that mean? I knew it was a delayed speech by talking to him, but I had to go learn what it was. This guy was on 3 drugs, and 2 of them were cholesterol drugs. Both of these cholesterol drugs had research studies already confirming that the highest age range group of individuals who develop aphasia as a result of taking this drug and its side effect was his age range. And I was like, well, I can't wait to tell him. So I actually had him come in the next day, and I told him, I said, I'm so excited to tell you what your problem is. You had no idea what it was. I said, you told me that your aphasia started 2.5 years ago. I want to know, when did you start these 2 cholesterol drugs? 3 years ago. And I said, so you were put on these drugs. Did you have high cholesterol? Him and his wife were both sitting there, and he writes on his little iPad at the time, he goes, doctor said it was for prevention. Didn't even have high cholesterol. He was put on it for prevention. And then we told him, I said, well, I'm sorry the Mayo Clinic never did this in the 5 trips that you went there, that none of them looked at your drugs to see, is this possibly a side effect of your drugs? They just were running diagnostic tests after diagnostic tests and never figured anything out. I said, all you have to do is stop your cholesterol drugs. Within 2 weeks, he was able to speak as he thought.
Did you ever get to see what his labs were? I'm just a lab nerd, so I'm curious.
He actually had like a 3-ring binder of all the medical records.
His cholesterol levels.
Oh, cholesterol levels, yeah. None of them were over abnormal. None was over 200, which is why I was wondering.
When my dad was in the hospital and I first was alerted and got involved in the charge nurses, I'm rattling off questions and she's reading through his chart. He's on Lipitor, which I had taken him off before, and he recognized it was causing problems, and then he got bullied back into it. But he said, I don't know. He was talking slow. He said, I don't know why it's taking me so long to get my words out. So I said, what's his cholesterol? What's his HDL and his total cholesterol? And she said, well, they haven't, and he's within the system. They haven't drawn it in all this time, but the last time they drew it, his HDL was 17, which shows up as a critical low. I mean, ideally, I don't know what you like to see. I like to see 60 or above to really get
15 above is where I go.
Right. And so I immediately said, hold that. Do not give that to him. I called his doctor the next day. My dad goes, I don't know what's going on, but I suddenly have this bracelet on that says Lipitor on the allergy bracelet. And I was like, oh, we're done here. And that was, within 3 days, he goes, okay, I don't know what you're doing, but I feel so much better. Just take control and do whatever you need to.
So I just want everyone to know that there's going to be these eye-opening moments. Yep. And there has been claims by some medical professionals in the last 3 weeks, after a lot of snake venom discussion has gone around the world, that I've actually been told that people say that I'm in some kind of manic phase. This is what they say. And I just want you to know, there's no part of me that's out of my mind, because in the same period, I'm not kidding, people are writing in all these texts. Do you think Bruce Willis got the shots? Do you think Bruce Willis got the shots? Do you think this is a side effect of the shots? And I'm like, no. All you'd have to do is ask him, when did he start his cholesterol drugs? And take him off of it. It has nothing to do with that. And because from experience, I've already seen it. It's phenomenal. So you're going to realize and learn that all drugs do not solely only have benefits. They all have risks and side effects. And it was one of the most eye-opening things to people to realize that a lot of the things they were struggling with were blindly. No medical professional was actually willing to even look at the possibility that what they were giving you was actually creating your side effects. But it is true. Yep. A lot of the times it's going to be related to that. So this AAA Ardis advocacy advice option, this is going to allow for the advocates at Graith Care to be able to screen through information, have put together their own recommendations for you based on your medical history and your current situation and the drugs you're being offered. Our job is not to re-prescribe you drugs. It's going to be to consult you. This is what I would do. Based on all the information that we have, this is what I would tell you. And then you've got people, no one knows you better than whatever doctors you've seen for years. No one knows your history, your blood work better than they do. But we are going to be able to give you advice and be able to consult you in a more specific way based on your story, your history. So this is an option for you now. It's going to be phenomenal, and Graith Care is excited about that, and I'm excited about it too.
Yeah, our team